This is the last in our series on diabetes insipidus, or as we now need to know it, Arginine Vasopressin Deficiency. And I'm lucky enough to be here with Professor Wass, who's now going to talk us through the resources that are available to us as patients, so that you can continue to be informed about the way to be best cared for. Thank you, Professor Wass.
Thank you, Debbie. And so this is an important piece of information which you and your next of kin really need to be fully on top of. There's a huge amount of information available from the Pituitary Foundation, our one and only charity for the pituitary, and I think it does provide huge amounts of support. But also recently we've updated all the things that there are for keeping people informed about diabetes insipidus or arginine vasopressin deficiency. And so the Pituitary Foundation's one source, and then Facebook's another source of information which you can access. And then YouTube, there are quite a lot of things on YouTube about, it'll be called diabetes insipidus, but it's now going to be called arginine vasopressin deficiency, as I've said. And then there are other activities that are underway to improve engagement and care of arginine vasopressin deficiency patients. And these include questionnaires, which we've been filing just to access and understand the complications that people can have when they go into hospital. And we're also in the process of setting up a registry for patients with arginine vasopressin deficiency so that we can actually use this very rare disease and the united access of information from a large number of different centres to actually derive research and understand more deeply some of the complications and some of the issues that patients with this condition have. And then lastly is the name change, and I think this is something which is important. It's a global thing, so that although we started it in the UK, and a lot of things in this country we started, and I think we're rather good at starting good things in this place, but actually it's been taken up by people in Europe, Miriam Price-Crane in Switzerland, Joe Verbalis in America. There are people in Australia, Japan and others, and so there's a united feeling that the name of diabetes insipidus should change to arginine vasopressin deficiency. Arginine vasopressin deficiency is the central one, arginine vasopressin resistance is the peripheral one. And so this is a global thing, and it's going through the iterations. It's complicated to change the name of a disease, actually, but this is going through the whole issue of getting this changed and agreed. And this is something which you'll know about in the future. And so bottom line is that this is an important disease. It's usually completely ably controlled. You need to know what to do and what not to do in terms of your fluids and so on. But I think having diabetes insipidus or arginine vasopressin deficiency is something which you can get on top of. It's not something which needs to get on top of you, and I think it's something which we can sort out. But you need to work with yourself, your relatives, and your endocrinologist to make sure that it stays under good control and that you remain well. Thank you.
Thank you
Debbie.
so much, Professor Wass. Genuinely, personally, and as a patient, I am indebted to Professor Wass for his care. I hope each of you has access to an excellent endocrinologist. I also want to acknowledge the contribution in order to bring together this video series provided by Pat Gilderoy of Got Diabetes Facebook group, an invaluable resource for us globally. Also Pat McBride at the Pituitary Foundation for her wonderful efforts in building out a repository of information and support for patients, and also ensuring that each of you really does use the resources that are available to you to stay safe and well. Thank you so much, everybody. I look forward to seeing you soon.
Thank you.